Looking to make a difference with your shopping? Visit communitypayitforward.us. Select the mission or cause you want to support and scan the QR code. You have two options. Click the first link and browse our giving partners, or use the second link to tell us what you need, and we'll find the right partners for you. Shop with these partners and keep your receipt or invoice. Next, click a picture or simply upload a picture of your receipt to the portal in every form, adding your name and email address. Your purchase now turns into a donation to the mission you've chosen. Community Pay It Forward shares your business story with those in need of your services to rally support for those who need us all.
Born into a real fight wasn't right. Where can she dream here? Took a hold of her life, left at night.
Hey everybody, how's it going? Zach Clayton, Community Pay It Forward, Community Dare to Care, and the PAC channels. We are here on the second Wednesday of the month, which means we've got our buddy Les Simpson. Hey, I just wanted to make sure that we give all the credit in the world to Jill Schultz, who is now a sponsor of the channel. That is JillESchultz.com. She is helping us to get this up and running, keep us going. So I want to thank and welcome Jill. I am going to run an interview with her next week, so you're going to meet her in person. Jill, like many of our guests, had something very traumatic happen to her. This is going to be a conversation that mom and dad, you're not going to want the kids in the room. It is pretty adult. It does concern something that unfortunately happens to kids and is not, you don't want your kids to have to deal with it. Unfortunately, Jill had to, and she's growing from there. So please remember, our focus on all of these shows is to try to find ways to help people in need. From everything that we do, everything working with Les, everything working with Melissa and One Hope Wines, everything we do is aimed at trying to support other people. Community Pay It Forward, we are part of this program, and that program is very simple. As you saw just a minute ago, shop, click, and pick. You take and you shop with any of our partners, any of them, and the list is getting longer every day. You go there, you satisfy your to-do list, your honey-do list, whatever you want to call it. You satisfy that list, you keep the receipt, you turn the receipt into us, and you tell us, hey, I want to support this cause or this cause. And then at least 3/4 of the referral fee that we get from that partner goes to help who you decided. You make the choice, you tell us who you support, because who I support doesn't matter. Who you support does. Joining us now, my friend, great partner, and a huge part of the Community Pay It Forward family, Mr. Les Simpson. How you doing, Les?
I'm doing great. It looks like you're continuing on. That's good. And the floods didn't wipe you out completely. You're a survivor. Did you know that?
Yeah, yeah, it's maybe not a survivor, but I did figure out that I need gills every once in a while because there was a lot of water down here. But um I do believe that I've got some gills growing and yeah, we're keeping it going. Glad to see that uh the rain is kind of, I guess, slowing down a little bit here because we were getting pelted just about every day. I wish that rain would go to some of these other places where it's been in 125 degrees, you know, but it'd be nice if, you know, the wealth would be shared, I guess.
But don't wish too much. Our weekend, we're going to want that water. There's supposed to be
Yeah,
3 days of over 100, which hasn't happened, I guess, 15 times in Colorado in its history.
oh, that sounds, I would say wonderful, but it doesn't. I know
No.
that we're going to be up in the mountains, so that scares me. Well, we're going to be up in the mountains,
Oh
so that's
yeah,
pretty cool.
you'll probably only be at 90
Yeah, there you go. There you go. And I mean, me and
or
my delicate
85.
skin. So, so Les, you got a little something here you want to talk about? This is our this is your program with Essentials Health Plan. Are you
Yeah,
ready to talk about that?
you bet. What one of the things each month I bring forward different things that nonprofits can use, and we've got something here that's absolutely phenomenal. And what I mean by that is this brochure. If you scroll up a little bit there, uh, the it shows for the companies and employee benefits. And we're going to be running a video here in a few minutes, which really is going to go into the employee benefits. But nonprofits, you are going to be able to help employees of every company with 20 or more employees. And what's really neat is the fact that under most circumstances, it doesn't cost the company anything. In fact, they actually make $600 an employee to institute this. And the government loves it. It's actually part of the Affordable Care Act. And so you're going to be able to partner with companies. The employees will get to know your mission. And of course, you'll have more supporters beyond what we're going to be doing. In fact, go ahead and scroll up a little bit more. For the employer, there is no investment. And for the most part, again, we'll show you the difference. But for the employee, they're actually going to get an advocate for all their health programs. And we're talking an advocate that you won't believe. Again, the 15-minute video will show you that. But through all this, you're going to get, as a nonprofit, $5 a month every month for every single employee. Now, I want you to start thinking. There's 3 ways to take advantage of this. We'll go over it again. Number one, your email list. If you send out this flyer, you're going to have companies say, hey, I want this. And for everyone that signs up, you get the $5. But the other thing is, if you have any fundraising events, next Monday, if you're familiar with the United Veterans Coalition here in Colorado, every month, every year, they have a golf tournament. I'm going to be there. We're supporting the United Veterans Coalition, and I'm going to be talking to 140 golfers. A lot of them are business owners. And so the coalition is going to have money. If they have 20 employees, that's $100 a month they're going to receive forever. As that company grows, it'll be more. If they have 100 employees, we're talking $500 per month. Now, for all you nonprofits, that can be yours. And the company's going to thank you for it. And so now I'm going to bring on my manager and mentor, on this program. I just signed up for this about 2 or 3 weeks ago. This gentleman here, he's been in it for a while, and Keith knows a lot more about this than me, and he gets to stumble as much as I do. So let's go ahead and introduce Keith.
Hey, thanks a lot.
How you doing, Keith?
I'm doing really good, Zach. How about yourself?
So you're the man who's teaching the man who knows everything.
Yeah, and I'm not sure how I could be the man if Les is the man, because I can't understand it. But
it's a little intimidating, isn't it?
It is. He's got a hard act to follow, let me tell you. And I'm super, super proud of him to go out and support our veterans and invest his time in showing them ways we can give back. That is a huge need in our country.
Yeah, it truly is. That is something that Community Pay It Forward is always trying to find ways to take and make sure that we are getting people to understand the need for our veterans out there and introducing these wonderful nonprofits that are out there that have to do with veterans. I mean, I don't want to take away from nonprofits that do other things, but the ones that take care of the people who gave up parts of their life to support us, and Les being a veteran himself, it's a very good fit.
Yeah. Well, I'm super excited to be here with you guys tonight. And I will tell you, with 14 years of history in the health and wellness space, I've never been more excited to be able to help people take care of themselves and fund nonprofits along the way.
And there's also an opportunity in this for people to supplement their income, correct?
Yeah, the way this is built, we've actually have an administrative fee that allows us to share in the wealth, if you will, as a referral partner. I don't think anybody's going to retire a millionaire, but there's a little love for opening a door. And if it's a big door, well, it could be lucrative.
Well, why don't we go on ahead and take a real quick 15-minute break, and we can watch this video, and then we can all come back and talk about what we learned. How does that sound, gentlemen?
That sounds great.
All right, here we go. This is a 15-minute video. Why don't you guys give us a real quick overview of what this video is?
Sure thing.
It's very much the employee benefits. It shows the different areas, and I'll is there anything that you want to add to that, Keith, before we go forward?
So at the initial onset of taking a look at this, I would tell you that this is one of the highest rated wellness programs that are out there. As a matter of fact, the gentleman who owns the company helped write the tax code that we use to facilitate this. So it may prompt some questions for you after you take a look. But at the end of the day, this is what I would call one of the best wellness programs that are available in our country right now.
All right. That sounds great. Well, and hopefully Les is going to come back since, this is his show. But he decided maybe that he was going to go and grab a burger while we're waiting. So
cover for him.
All right. Well, there he is. He's back with us now. But we're just going to start this video, and we'll see you all in about 15 minutes. Enjoy the video. If you have any questions, please use the comments section and ask any questions. We've got Keith and Les who are here to answer all of your questions this evening.
Hello, my name is Megan and I'm a physician assistant with Amaze Health. If you're watching this video, that means that you have enrolled in a new health benefit called Amaze, and we're so excited that you're here. Over the next few minutes, I'll discuss all the services we have to offer. I'll guide you through accessing your new Amaze account, and I'll educate you on why you should consider Amaze Health as your new healthcare partner. With that being said, if you take home one thing that you learn about Amaze today, it's that you should always call Amaze first. Whether it be a medical issue or a billing question, we have providers available 24 hours of the day, 7 days a week, and we are available nationwide. Now let's dive into some of the services that we offer. Our chronic care team offers primary care and preventative services, and so they can act as your primary care provider and refill your medications, order your labs, place referrals, and make sure you're up to date on all your recommended screening tests. We also have professionals that can help you towards your health and wellness goals, whether that be improved nutrition, weight loss, or even smoking cessation. And of course, if you already have a primary care provider, we're by no means looking to replace them, but rather complement and work with them to fill in any gaps in care. For example, we know it's a very busy world out there, and many people may only see their provider once or twice a year. And say you just need a routine medication refill, and you call your provider's office, but they can't get you in for 4 to 6 weeks. That's where AMAZE can step in and refill that medication for you. We can also order your labs proactively before your annual physical. So that way you have your results in hand and can review them with your provider and truly make the most out of your visit. We also offer virtual urgent care services. And so this allows you to get prompt medical attention for all of your urgent care needs, usually from the comfort of your own home. From a cough to a sore throat, or maybe your child is running a fever, you are always just one click away from being connected to a medical provider who can help you. Even if you think your issue goes beyond virtual care and needs to be evaluated in person, call us anyways. There's a high likelihood that our providers can treat you, and if not, they will direct you to the most appropriate care. For instance, I'm a physician assistant and I have experience working in a busy urgent care setting. I recently had a patient message into AMAZE concerned that he had broken his foot the day before. I was able to get him on camera and perform a virtual physical exam, and based on my assessment, I did have strong suspicions he may have fractured his foot. And so instead of him spending an hour or two in an urgent care waiting room, filling out stacks of paperwork just to spend limited face-to-face time with the provider who's likely going to order an expensive x-ray and refer to a specialist for follow-up, we were able to accomplish the same outcome. I ordered an outpatient x-ray at an independent imaging facility. My team researched both cash pay rates and insurance contracted rates to help the patient make an informed decision about his options. He was able to get the x-ray done that same day, and I had the results within an hour. Unfortunately, the fracture was confirmed, and so we found him a cost-effective walking boot and crutches at a local medical supply company, and my team called around to secure him an appointment with a local orthopedic foot specialist the very next day for follow-up. And so, as you can see, we accomplished the same outcome while also saving this patient time, money, and the hassle of an urgent care visit altogether. We also offer on-demand mental health services. And so for those moments when life stressors become overwhelming, or maybe you're in the midst of a panic attack or a depressive episode, you are always one click away from being connected to a mental health professional who can support you. Not 4 to 6 weeks from now when you can finally secure that appointment with your mental health provider, but they're available in the moment when you truly need them. This is a good representation of our mental health team and the different tiers of support that we can offer you. Our team consists of psychiatric nurse practitioners who can evaluate, diagnose, and treat mental health conditions. We have licensed counselors who offer counseling and therapy services. We also have mental health registered nurses who offer continued check-ins and support between your visits with our other providers. And lastly, we offer peer support, connecting you with individuals who have gone through similar life experiences. For example, if you're a single parent of 3 children, we may connect you with another single parent as you share similar stressors and experiences, and this can be another form of support. As I mentioned, our team's priority is to provide you with the support and treatment when you need it. Whether your care needs to be elevated within our program or you transition to a point where you only require periodic check-ins, remember, you are only one click away from getting the support that you need. We also offer second opinions, which I find is underutilized. And so just like we shop around for big purchases, we do our research. We don't always buy that first car we test drive or that first home we tour. We shop around and make sure we're getting the best deal for ourselves. And we don't always do that when it comes to making medical decisions. As a medical provider myself, I cannot tell you how many times I've had a friend or a family member reach out to me asking me for my medical advice. It could be about a new medication that they started, or maybe their provider is recommending some procedure or surgery, and they want to learn more and make sure it's right for them. And I support them in any way that I can and offer my unbiased medical advice. Here at Amaze, we are that same trustworthy medical provider for you in the back of your pocket, ready to answer any of these questions. We have a diverse team that spans specialties such as dermatology, women's health, pediatrics, and even a dedicated orthopedic team. So there's really no question too big or too small. We're just here to help you and support you along the way. And lastly, for any of your medical billing concerns, we have an insurance team here to assist you and help you navigate any complex billing situation. And the best part is all these services are included for the entire family. That includes yourself, your spouse, and any children up until the age of 26. And now you may ask, how do we provide all these services that I mentioned? And I'd like to touch on a few things that make Amaze unique and maybe different from other telehealth services you've used in the past. First and foremost, we offer a friction-free, one-touch communication model, and we always put our providers first. That means you are always only one click away from being connected to a medical provider. That provider being a physician, a nurse practitioner, or a physician assistant, someone who can evaluate and treat you. There are no forms or questionnaires to fill out. There's no nursing triage line and no appointments necessary. Just direct access to care when you need it. All of our providers are W-2 employees. They're not contracted out, and they truly share our mission here at Amaze and are here to be your advocate. There's also no per-call reimbursement, and so our providers are not pressured or incentivized to take more calls or see more patients, and they can spend as much time as they need with you. And our team is highly collaborative, and so if you're seeing numerous members of our team for different issues, they will collaborate and work together, meaning you will always have a team of medical professionals behind you, supporting you along the way. At Amaze, all of our services are included. You will never pay an additional copay charge, and we will never bill your insurance. We also follow up. So if you have a sick visit or other medical interaction with our team, they will check in on you within 24 hours to be sure everything is going okay. If your treatment plan needs to be changed, we'll make those adjustments, and then we'll continue to follow up with you until your issue is resolved. And just to reiterate, all of our services are designed to save you time and money. We hope to reduce unnecessary emergency room visits and urgent care visits, and even specialty visits if it's something that we can treat appropriately here at Amaze. We also help you price shop and direct you towards independent imaging centers, laboratories, and surgery centers to avoid those high-cost hospital-based services as much as possible. Now that you understand some of the services that we offer, it is now time to activate your account. Please check your email where you will find a Welcome to Amaze email with your username and the ability to set your password. If you did not receive the email or if you have any issues getting into your account, please call this 720 number. I also recommend saving this number in your phone as it is another easy way to connect with our medical and advocate team. After you activate your account and set your password, you will want to download the Amaze app on your smartphone. This is an example of our app and is available for download on any Apple or Android device. Once you open your Amaze app, you will see how easy it is to contact us. This is an example of our home screen, and you will see two ways to connect. You can either give us a call or you can send us a message. Either way, you'll be connected with a medical provider who can help you. This is an example of our messaging screen, which is a great way to connect with us for non-urgent medical issues and follow-ups. You can attach pictures, lab results, and other documents here using the green paperclip to the bottom left. As a reminder, Amaze services are available to the entire family. So within the app, you will find a drop-down menu that allows you to add your family members, your local providers, and any upcoming appointments. The app also includes a health summary page where you can store important medical information. This would include any medications that you're taking, any allergies that you may have, as well as any other significant past medical history. This is important for our providers to know, but can also be a valuable tool if you're at an outside doctor's appointment or even in an emergency, if you have all this information easily accessible within your app. We have an insurance dashboard where you can store your insurance information. If you have a major medical plan, it will be connected to a clearinghouse that will provide you with real-time deductible information, as well as other important insurance details. As I mentioned earlier, we will never bill your insurance, but it is helpful for our team to have this information so that way we can work within your plan to order tests, place referrals, prescribe medications, and help you with any insurance or billing questions. We've also added smart trigger notifications that you can enable once you activate your account. These features are recommended, but by no means required. And so when you log in for the first time, you'll be asked to share your location. I promise this is not to track your location, but rather we've added geofencing around local emergency room parking lots. And say you're rushing to the ER because you have a medical need and it's late at night and you're not sure where else to go. Once you pull into that parking lot, you will get a notification to call AMAZE. As you're connected with a medical provider, they can help guide you to the most appropriate care. Maybe that's to direct you to a cheaper alternative, such as an urgent care. Or maybe it's something that they can treat and you can avoid the ER or another doctor's visit altogether. And if you do need to be in the ER, they will let you know that and stick with you and follow up afterwards. Additionally, the app will ask you to share your calendar information, as it will pick up on keywords such as physical or doctor's appointment. Now, if you choose to share your calendar information with us and the app identifies a new doctor's appointment, you will get an alert asking if you'd like to notify us of your appointment. There are so many things we can help you with. For example, we may be able to get you in to see someone sooner. We can verify that they're in network with your insurance. You can even consult with a medical provider before your appointment to ensure you're fully prepared and know what questions to ask. There's a fun resource page with an educational center and a medical grade symptom checker. Our providers can prescribe educational modules to further your understanding about various medical conditions or simply to improve your overall health and wellness. For example, if you were recently diagnosed with high blood pressure, they may assign you a module to complete about hypertension so that you can learn and fully understand your new diagnosis. We also have a custom button where you can store any links or portal logins that would be helpful for you. Now that you've activated your AMAZE account, you will have access to all the features and benefits that I've mentioned and even more. We are truly here to help you navigate the system and make informed decisions regarding your medical needs. For example, some of you may already know this, but paying cash can sometimes save you money on certain tests and procedures, and you do not always need to go through your insurance. Additionally, prescription prices can vary just depending on the pharmacy that you fill them at, and even with different pill types and dosing instructions. And lastly, not all tests ordered are necessary, and it's okay to say no and important to get those second opinions and research your options. And with AMAZE, you're never in this alone. You have a partner to ensure you're always getting the best care at the lowest cost. And finally, just to wrap everything up and simply remind you, your first call should always be to AMAZE. We strive to be that trustworthy medical partner in the back of your pocket, ready to answer your questions and guide you with unbiased medical advice. As I mentioned before, there's no question too big or too small. So when you're in doubt, call AMAZE. Thank you for watching, and please reach out should you have any questions about your account or the services that we offer.
All right, Les and Keith, we are back.
First off, is there any questions?
No. I didn't have any questions as of yet. There was somebody who asked about how their kids, because they had college kids, but then I noticed on there that it said 26, so I was able to help you guys out there. And answer that question, but the age of the kids was the only question that we had right now.
Okay. And one thing to clarify, what was going on the bottom, the Savings Highway Global, that was the program last month where we go in and renegotiate all the expenses of a company, and the nonprofit gets a donation from that. Just to clarify that if somebody clicks on that. So I hope everybody sees how tremendously amount that you would be helping the employees of all the, because it's kind of like I told one nonprofit the other night, that it's kind of like a second mission that the nonprofit is on to now help the company so the company can help them. And in fact, the Veteran Ranch, to let you know, we're talking to one of your fellow nonprofits that help veterans with equine. And they met the board last night, and they're seriously looking at going forward. So especially the Veterans Ranch, let's talk, because there's a lot of veterans out there and first responders, and what they serve is autism on kids. And so let's help out on those. And is there anything else you want to add, Keith, before we go into your part?
You know, I thank you for asking. In the 14 years of being in this space, there's all these companies. Like when a second opinion service came out, that was a standalone product. Then, like the renegotiating of your health bills was a standalone product. I could talk for an hour on how amazing Amaze is. They bundled so many things into one great service. Specifically, I think the most important thing right now, post-pandemic, is the unlimited phone calls to a mental health provider. I mean, for crying out loud, some days I wake up and if I accidentally watch the news, I think I should call. It's usually 2 or 3 visits a year, and then you have to pay. This is 24/7, 365, call as much as you need. That's a game changer, because the billing that happens after call 2, 3, 4, or 5 for an organization, that gets tacked on to the bill. The employee pays, the employer pays, and that's why healthcare costs are always going up. It's sadly kind of designed for that to happen. But we won't get into that today on this call. So I'm super impressed with the Amaze product. That is the wellness portion of our solution that everybody gets. So if I can figure out how to present, the other thing is that's really, really cool is that.
Yeah. Let me end this. I do have a question here from Jan, and she was wondering, it says here they were talking about something around the emergency rooms to where they're going to tell you if there's a cheaper place to go. Can you guys explain that a little bit?
Happy to. Thank you very much for your question, Jan. I'll give you an example. And you know, Jan, if you have kids, you could probably relate to this, but when there's an emergency, all you're thinking about is going to the emergency room.
Yep.
Like, I have an issue with my child and I got to go. So we're not always thinking very clear. So we just jump in the car, we go to the emergency room. And this organization has what's called a geofence around the emergency room, which notifies the Amaze team that there's less in the parking lot, and he gets a text message. And the text message is going to say, hey, Les, we noticed that you're in the parking lot at the emergency room. I'm a doctor. If you'd like to pull over safely and have a conversation before you go in, let me know. Les ignites that little text message and says, how can I help you, doc? And the doc's like, no, Les, how can I help you? And Les says, well, I have my son in the back seat and he has, I think, a broken toe. We'll just go with that example because she used it. And the doctor's going to say, well, Les, here's the deal. You walk into that emergency room, and if you think you need to do that, you go right ahead. It might be like $3,000 And I'm looking up your health plan here. It looks like you have a $9,000 deductible. So I don't know if you've hit that yet or not, but that's probably, and I'm making up numbers here. I don't know where you live or what the real cost is, but just for examples. If you go in today, it's going to be $3,000. But let me tell you what we do for a broken toe. We tape it to the other toe.
Mm-hmm.
Another idea, 3 blocks down the road is an urgent care. They charge $1,300. And that would be put toward your deductible. Or if you'd like, I could find a person that specializes in looking at toes and get you in tomorrow or the next available appointment where you can pay your copay of $25. So why don't you hand the phone to your son? Let me do a visual inspection. Take a look and talk to your boy real quick. And by the way, is that Tommy or Joe? Because we have your family history in the app, so we know who your boys are. And then we're going to take a look. They have the ability now with these fine devices to take a picture or do a FaceTime call and connect, and they'll look at the toe and they'll like, yep, it's black and blue. What do you want to do? Because we're here to support you. And if you're going to go in the emergency room, we're your advocate. We want to make sure that you don't get conned into doing something that you really don't need, like a blood test. We're here for a toe. So that's the advocate nature of that team knowing where you are and helping. So Jan, I hope that answers the question. Keep me in line here, Zach. Did I come close to hitting that?
Yeah. It was the gate thing that
geofencing.
Right, the fencing thing that was a little, it was a little curious. I didn't understand it either,
Yep.
but the one thing that I really like, and the one thing that I really like to hear is that you don't have to take all the tests that they want you to take this test. And a lot of times, and this is coming from a guy who's walked around and who has had every test possible because they just want to delay. And I walked around for 3 years with a broken neck. I walked around for a year and a half with a torn pectoral muscle because they wanted to test and do this and do that and do that. And the truth is it's like, look, there's a bigger problem here. I know the problem. So I like hearing that, they're going to get stuff done without, having to go through all those tests.
Right. Well, I'm sorry you had to go through that, Zach. It's unfortunate, but and I've been with my same primary care provider. I almost said PCP. No acronyms on this show. And I go in with a something what I think is wrong, and he's like, "Oh, I think it's this. Just try this." And they don't see inside your body,
right?
They don't know. I mean, they know some things, but there's just sometimes there's that mystery. So the second opinion, we used to, when I sold that product as a standalone, we would charge companies a certain per employee per month to have it, whether you used it or not. So it was a big expense, but it saved so much money because you go to the emergency room, you fell down skiing, and they're like, well, we got to order this CT scan, this CAT scan, this scan, that scan, here a scan, there a scan, everywhere a scan. And then all of a sudden they're like, we think we should do surgery. Well, and this is the guy who made that company. His story was, I got to talk to somebody else. And they got they're like, well, actually it's just a nerve pinched in that vertebrae, and you don't need the full back surgery. If you could just fix that little part there, it would cut your costs down by 84%. Who'd have thunk? But you're in the emergency room. We got to do all this stuff and everybody's rushing. He said, time out. Let's get a second opinion. So the Amaze is packed full of benefits. That is for the whole family up to age 26. They do have to grow up on their own, but I'd encourage him to get a job at some place that has Amaze. So, to be able to help employees, especially those, in the world of accounting, if you're a business under 50, you don't need to offer healthcare benefits. And so I know Les and I are both very passionate about helping companies like 20 to 50, because we have a great way to show them how to get government sponsored benefit options that doesn't change their paycheck. and doesn't cost the employer a net cost to do it 99% of the time. And so we're super excited to be able to go to our partners and say, hey, you know people we don't know. I've heard less do cold calling. We'd rather get a warm referral.
Right.
Yeah.
Yeah. What is, let's just go with that right there. For businesses, what is like what's the major difference between this program and, say, one of the other bigger insurance companies? What is there a huge difference between the two?
Yeah.
Financially and coverage wise?
Yeah, great question. Thank you for asking that, Zach. So there's two parts. One would be this is a MEC plan, which, the best thing Obama ever did for our country, in my opinion, was make the ACA for providing care. Fundamentally, I think there's some healthcare companies that are taking advantage of the way it got set up, but we'll put that on a different call. So it's not major medical. So if you're like, I think I need a hip replacement, it's not going to work. If you're pregnant, not going to be covered. However, I did go into a Subway and I talked to the manager and I asked her, so could you tell me what kind of benefits you have here? And she says, we don't have any benefits. And I'm like, well, how does that make you feel? And she said, well, as a matter of fact, I'm having some stomach problems and I wish I could go in to the doctor, but I can't afford to go to the doctor. Which in turn, what that means, what normally happens is she doesn't go. So unfortunately, it's too late. Something major has happened. She gets there, she doesn't have coverage. And then the taxpayer picks up the bill, which is why the ACA was made, so that everybody could have affordable coverage. So sad that she didn't go on and apply for coverage because there's grants available. So if you're getting a grant on something else, or if you're on like Medicaid, you wouldn't be able to get this program because you can only take from the government funding from one pool or one bucket. So the companies that are under 50 don't have to offer, and most of them don't. They usually can't afford it, don't want to, or it's just an unknown, uncharted territory. Secondly, I'm working with a company right now that has 300 employees. Things are tight right now. The market's tough. Expenses are going up. Cost of healthcare continues to go up. They surveyed their employees and asked this question: would you like us to continue offering short-term and long-term disability, or would you like us to contribute to your 401k? What do you think they picked?
401k.
That's right. So I asked the CEO, what was the participation rate in your short-term and long-term disability? He says, like about 10%. And I said, well, who paid for most of it? The employee. So if I'm hearing you correctly, we don't offer short-term and long-term anymore. He goes, no, we just got rid of that program. So for that company, they already have a major medical plan. So they don't need to buy our MEC, minimum essential coverage plan, or offer that to their people because they already have it. However, due to the tax savings, they'll probably save close to $250,000 a year. They'll have the AMAZE plan. And then every employee has an allocation of what they can spend their allocation on. So I'll bet you the majority of their people are going to take a serious second look at short-term and long-term disability. On a side note, that the option of having short-term and long-term disability for your employees, if they've never had it, could be very beneficial from a work comp claim status. And there is also, in about 41 states, the ability for us, because we're lowering taxable income, have the ability to lower work comp costs as an additional benefit to the business. However, and I've been in this business a long time, guess when the most work comp claims are filled?
Well,
When do you think that most of them are reported, filed?
not right away. I know that.
Yep, they come in Monday morning because I had something happen on the weekend, and I'm figuring out how can I drag this over to my employer so it's time off and work comp and I'm not paying out of pocket. If you've provided your people with a way to have coverage, they're going to take ownership and say, well, I've got coverage. I'm just going to get it addressed here Friday night or Saturday. So it's another way to save the company money. And lastly, I'll just tack on another way to save company money is when you have a maze working in the background and they're sharing with people, you don't need to take that test. You don't need to do this. You don't even need to be in the emergency room for your broken toe. That employee isn't paying so much out of pocket anymore. That employer isn't getting dinged, and their health plan costs usually go down somewhere between 17 and 23% when they already have their own healthcare plan. So it's pretty fun. Does that answer your question, Zach?
Yeah. I just, the whole staying out of the emergency room, that's exciting to me because I hate going into the emergency room. It's not a lot of fun. Not a lot of fun at all.
No, and unless you have like major amounts of blood coming out or pass on the floor, you're looking at hours usually and hours. And then they're kind of going, well, let's guess what's happening.
Yeah, we're going to give you a Benadryl and send you home.
Yeah.
So
that's their job, by the way. How can we patch you up and get you out of here the quickest?
Right.
How do we get you on to the next deal?
Yep. So to share your screen with us, Keith, all you have to do is down on the bottom, you'll see a present, and it's like a little TV with a plus sign in it.
Sure.
You touch that, and then it should say share screen.
Sure. It says it's easiest with 2 monitors, and I jumped on with 1 monitor, but I'm not afraid. All right. I think I can get it. Oh, let me know if you can see my sample paycheck.
There you go. Let me get this out of here. And I'm going to pull us off screen, but people will still be able to hear you.
Perfect. I just want to take about 5 minutes here and see if we can prompt some questions. But at a 30,000 foot view, I want to show you. By the way, there's other programs that are out there. And I'll just tell you that I'm not here to name names or throw rocks at anybody. But a couple things to note the way we do this is that when we bill for a wellness plan, we actually put the same amount of money into a paycheck that is taken out for the wellness plan. So this example is from somebody in Virginia making about $39,000 a year. So we're looking at a monthly paycheck. Their current wages is about $3,300 a month. And so this left column represents their current paycheck. The right column represents their check with the wellness plan. So what happens is in about 42 states, when we add the wellness plan and drop the taxable income from 32 to 2,000, that's where your work comp may go down somewhere like 20-30%. But what you'll notice here, after we lowered a pre-tax health deduction, your federal FICA, SUTA, FUTA, Social Security, all these other random taxes are lowered by about $300. So those $300, that was the bell to let everybody know how cool that would work for you. It's really hard to time that on these. I just want you to know. But remember that $300 because we're going to come back to that in a hot minute. Over here, you'll see some FICA savings. So most companies that collect FICA will save 7 and some percent. And of course, we're in the middle of 2024. It'll probably be more later. But what that net does is it gives the FICA savings to the employer to the tune of about $90 a month. So the program, you'll see the fees here in a little bit on how this works. This, though, is where Les was talking about saving about $900 per employee per year. So if you just take a company, for instance, that let's just use 45 employees just for fun. They don't offer benefits because it's not required by law, but that business owner now is going to realize about a $900 savings per employee per year. So that's $40,000 that business owner now gets to keep in their pocket. Yeah. So what I'd like to do is say, hey, Mr. Business Owner, if you have 45 employees and I can show you how to save 40 grand over the year and give your people benefits, would you have any interest in giving me 20,000 of it? I mean, why wouldn't we donate that to the veterans or the horse I mean, there's just so much to do with that. Or, put them on an auto ship to fund the nonprofit or something along those lines. Or maybe just get the whole 40. We'll see how that works. In any event, moving right along down here, then through, and I won't bore you with all the terms, but through the non-taxable reimbursement for the exact same amount that we took out, we're going to put it back in, and the net take-home pay is exactly the same. So your check doesn't change, but you have $300 to spend. So let's move into the spending of the $300. Here's your $300 wellness plan. And Amaze is $89, and there's $200 left over. You may want to use short-term disability. You might want to do a critical illness. Cancer is on the rise like no tomorrow. I just spoke with a agent that sells insurance with this company that has a duck for a spokesperson, and he was like,
I've heard of them.
Yeah, there he goes. Keith, we are seeing some crazy things in the world of cancer right now. Like, you have no idea. So maybe that's something that runs in the family. You'd like a critical illness plan with a cancer rider. Maybe you'd like to have some hospital coverage in case something does happen because you don't have any kind of health care. We can put a little something together for you here. Or here's an accident benefit, or maybe life insurance. Let's say you have all these things covered. You got dental covered. You've got vision covered. Maybe you get a life insurance policy that builds value over time. There's a lot of life insurance policies to choose from. And as everybody enrolls in this, everyone has a one-on-one conversation with a licensed insurance agent, just like myself. And they work through your own personal plan for you and figure out, well, what are we going to do with your $219 a month? If they don't have insurance currently, we walk them through using their fees. $89 is the fee for the Amaze, the wellness plan. Then if we add a MEC plan for the family, it's $109. And in this case, that family who makes about $39,000 a year still has $100 left over to put into whatever they want. It is a use it or lose it benefit. If you don't use it, we throw it back into the ACA for the government to give to somebody else.
Okay, so Jan is back in. This money that you're talking about, it's not like a flex spending account.
That is correct. It is not like a flex spending account. Great question. It is you allocate the monies right here and you decide, where do I want to spend it in real life time?
Perfect.
Great question. So let me go back to one thing and I'll close this out. The fee that we charge is $40. So that is paid for out of the FICA savings. So in all reality, the business owner is going to get about $50 per employee per month, plus work comp savings if they're there. So it's usually close to $90. But at the end of the day, this is how we pay for the products and services. And with the tax codes, that's how we add the wellness plan to your check. So you free up this money to spend immediately for you and your family. So on that note, let me see how to close this out and stop sharing and bring it back as we come in for a landing.
And so you're looking comparative price-wise to any other coverage.
Well, let me unpack what you mean by that. When you say price, comparing it to that 300-person company for the major medical?
Yeah, well, once again, you did mention that this doesn't cover everything that the major medical does.
Right.
So is this more of a supplemental insurance then? Is that kind of where we're going? That this is more of a supplemental that you can save money on, like the smaller stuff. Instead of going in for the flu, it's going to save you more money there.
Yeah, that's a good question too. The average cost of healthcare in the country right now is about $14,996 per employee per year. That's what has to be paid. So your employer has to figure out, well, how much am I going to pay for Zach? And how much is Zach going to pay for Zach? And what's happening in the country right now is we're going from, I used to pay a little bit, but now I got to pay more as an employee. And the days of like a small deductible, they're getting bigger.
Yep.
Used to be 3,000. Now you're at 5,000. And it used to be once you hit your deductible, it was an 80-20. Now it's more like a 70-30. So even if you do have major medical, what most people don't understand is that it's not all covered anyway. More and more things are not being allowed. More and more drugs are being cut out. We just can't afford it. We need less to pay. Les should pay his own bills. We're not doing it anymore. We've had enough. So it's not major medical. It does meet the ACA guidelines and has 64 of the necessary requirements to qualify as an ACA plan to cover your specific preventive maintenance. Meaning, you need a mammogram? Covered. Colonoscopy? Covered. There is no, are you in network? Can I go here? The way it's set up, you just pick your place, let them know what's happening, call Amaze. We're going to find you the best place to go, and you're going to get checked out. It is the people who are 50 and over that have to, by the way, not everybody, I'll just tell you a little story real quick about a company here in Minnesota, 980 employees, very high risk employees. I won't tell you what they do, but they do a lot of traveling and they're in very rough environments that are very risky. It was cheaper for that company to not pay for healthcare and pay the fee, because the fee to not pay for healthcare was cheaper than healthcare. They just joined us. Their people are ecstatic. Thank you. I finally have something. So we're not comparing apples to apples here. This is like a grape to a watermelon. The MEC plan is specifically named MEC, minimal essential coverage, so that if something is going wrong, and if someone's working at that particular company and they find out something is going wrong, now we can take other steps to find coverage and figure out, well, what is my next step? And that's the time when you have to go out to the open market and say, okay, well, what's out there? And the open market, if you go to, like I'm in Minnesota, so we have a thing called MinSure. I have a tool that lets me tap into every state, but I say, where do you live? How old are you? And how much do you make? And then it comes back and says, well, Keith, you make $30,000 a year. You should qualify for free coverage. There's no pre-existing conditions that kick you out. So if you do finally go to the doctor because you finally found out that you could go because you have a MEC plan and they said, hey, there's something really not good here, now's the time to step up and go. And I've helped a lot of people. All of a sudden they have a no monthly payment and a low copay and a low deductible, and they can get in and get covered and get seen right away. So very good questions.
So
one thing let me mention, right now he has Keith's information on here. Please contact me. Keith wouldn't know where this came from. He has a lot of people and different presentations he does. So please contact me at the 3 Ways to Banking. And we will consult Keith if there needs to be any more, but first go through me.
All right. Sounds great. And Keith, I just had one more question for you. You got the MinSure there in Minnesota. So does that mean that Les in Denver has DinSure?
I think it's ColoSure there.
I had to do it.
It's good.
I think I'd prefer DinSure than ColoSure. That sounds a little invasive.
How's your teeth? Did you say you needed dentures? I'm sorry, what?
Yeah, I need DinSure. So, but this is wonderful, guys. I appreciate this so very much, and I think this is a great program. And so, Les, they contact you with any questions, yes?
You bet.
All right, sounds good. And of course, remember, anytime that you need to contact Les, if you would like an introduction, simply get a hold of me and I can make that introduction to you. We talk all the time, so it's easy for me to get a hold of him. Keith, thank you very much for your time and joining us tonight. I greatly appreciate it. It's nice to see meet the man that taught the man that knows everything. So it's great to meet you.
Hey, God bless you guys. Thanks for your time.
Thank you. Les, another show, another month. It's sad that it's come to an end, but I think this was a very, very good month. Learned a lot. Do you have anything else that you want to say to people before we let you go?
Yes, all of the nonprofits, especially if we have any board members or whatever, remember, a lot of companies that need this, and your nonprofit is going to be able to profit in a way it just couldn't before. And we're talking residual donations every month. And so I want you to get with your board and contact me, because this needs to be done. One thing, I was with a nonprofit meeting the other day, and one of the head ladies says, unfortunately, there's only so many dollars out there for people to donate. Well, this is an alternative. Everybody benefits. The company pays you, or we pay for every employee. So let's take advantage of it. Contact me, contact Zach. There's about 15 nonprofits that are part of this. So let's get you some funding, and have a great evening.
Yeah, and guys, just remember, this is kind of akin to, say, you're signed up with King Soopers program, to where when people shop with King Soopers, you get a small portion. This is akin to that, but this is with insurance, which is something that everybody really needs, and not a lot of people. Or there are situations where the people don't get, because insurance is just a crazy, crazy thing to try to figure out. I think that you got to have like a screw loose or anything to try to follow everything that goes on in insurance. I talk to people who try to figure out insurance, and they confuse me. So, but this is really a way that you can take and support your nonprofit by helping people. So just make sure that you reach out to us. You can get a hold of Les at 303-579-6881, 303-579-6881, or you can contact him at Les at threewaystobanking.com, Les at threewaystobanking.com, or of course, you can always get a hold of him by coming to us at communitypayitforward.us. Les, thank you, my friend.
You bet.
All right. We will see you next month.
You bet. Have a good one.
You too. Fantastic. Look, insurance is difficult to understand. I think that we could probably listen to that. Listen to what Keith and Les brought to us. We could probably listen to it like 4 days straight, and pick up little things out of each time. And I think that's one of the reasons why you really need to reach out and talk to them personally, because it's easier to ask them the questions than have somebody like, me just kind of stumble through asking questions. But if you reach out to them and you ask them, you'll get that clarity that you need. So I want to thank Keith for joining us all the way from the great state of Minnesota. I still like Denshire a lot better than Colosure. Colosure just sounds uncomfortable. It really does. So, but when we get back, I'm going to play the interview that I had with brand new giving partner, Sixu Chen. Sixu is a beautiful, beautiful young lady who is very, very busy, and she's got a program that can help you make sure that your life balance is in zen with your work balance. Because if one falls off kilter, they're both going to fall off kilter. And I know this for a fact, because as I bring up in this interview, that happened to me in my last job. And I ended up doing something weird there. That leave it up to me to do something weird. So when we get back, oh, my co-host is here. Thank golly, she stopped in for something, and she's persistent. That's awesome. But anyway, when we get back, Sixu Chen is going to be joining me. Well, actually, she already joined me, but we're going to be talking to her and learning more about how you can get your life and your work balance all put together and live a better life. Looking to make a difference with your shopping? Visit communitypayitforward.us. Select the mission or cause you want to support and scan the QR code. You have two options. Click the first link and browse our giving partners, or use the second link to tell us what you need, and we'll find the right partners for you. Shop with these partners and keep your receipt or invoice. Next, click a picture or simply upload a picture of your receipt to the portal in every form, adding your name and email address. Your purchase now turns into a donation to the mission you've chosen. Community Pay It Forward shares your business story with those in need of your services to rally support for those who need us all. Great to introduce another brand new family member, Sixu Chen. How are you doing today?
Doing all right. Had a great 4th of July, so ready to roll and get to work again.
So as people can see beside you, you don't do a whole lot, right? I mean, your plate is wide open. You don't have much business going on. No, you've just got 3 businesses that you're involved with.
Yeah, just 3.
So, what are you just that interested in being in different kinds of businesses? Is every single one of them just a fulfillment of something you enjoy? Why do you have your hands on so many different types of things?
I think it is what brings fulfillment to me in all different areas. For example, you can see on the top one, Beth Bloom Designs. Um, Beth Bloom is a dear friend of mine, and I love working with her. She opened her own interior design firm, design restaurants, nightclub, and bars, and food and beverage areas. And we really work well as a team. We have a team of talented designers, and design has been my passion. I graduated with interior design degree, and I have 13 plus years experience, and I don't want to give it up. But working in corporate America before, it was just burned out, and I wasn't really able to really utilize my talent because you have to listen to the upper hand. But designing with your best friend, it's a different experience, and I love it, and it's fulfills my creative desire. Like, it is my creative outlet. It's like transform spaces. Like, I'm all about transformation. So that business is transform spaces, and my own business, I see coaching group, is transform lives. So
And when you say transforming lives, you're trying to come at this to where you are incorporating all points of life, work, relationship. You want to make sure that you're talking about an entire person, right?
yeah, absolutely. I mean, there's so many areas in our lives, and I am focusing more on helping them with the profession and personal in terms of career and relationship. So I help individuals that struggling with dissatisfaction about their job. They do not like their job. So I take them through a self-discovery process so they can get clear on their talent, skills, passion, and value to find a job where they can finally be able to be their most authentic self, be able to reach their potential, and most importantly, more self-expressed. Like, the reason I'm doing 3 things because I have different talents, I have different interest, and if I only focus on one, the other one are being left behind and ignored. And this is why I coach people, just like, we want to discover all your talents and make sure we can utilize them to bring fulfillment in your life. So after the self-discovery process, they are going to create a unique career path for themselves. For example, I had a client who was a nurse, but he felt burned out and he was like, well, I love doing nursing things, but it's like, I don't see myself doing this kind of until retire. I feel like this is not going to be sustainable. So after we did the self-discovery process, he had an interest in real estate. So now he's thinking to combine his nursing background with real estate and actually become a developer for senior homes. You see how beautiful that
Yeah.
combination is?
Yeah. Absolutely. Burnout is caused by what? In with what you see, what is burnout usually? What's the first step of burnout? Is it just accepting a job that you're just not right for, or is it just an overload?
I think there's so many different factors come to burnout. One could be that the job is way too challenging for your skills. It doesn't mean that you are not good enough. It doesn't mean you're, less than. It just means that this job is not right for you and your skills should be utilized for somewhere else. And another thing for burnout is just overworked. Like, I used to work 80 hours a week. I mean,
Mhm.
I'm not a machine. Like I need rest. And when you work that much, it is a burnout. Like your body literally get burned out, right? And another thing also is emotional stress. Like if you are unhappy, you don't want to go to work, but you drag yourself to, all that energy you spend in the back of your head to get yourself up and going. That's a lot of energy. That will burn you out too. So
And that last one there, the stress, that could also have a lot to do with your relationship at home, could it not?
absolutely. That's why I want to help people in the both area because I feel like if you are unhappy with your job, more or less you're gonna lash out at your partner when you go home, or at least not gonna bring your best self to spend time with your partner because you're not happy inside, and it's hard to pretend and put a smile on your face and have a good time, right? So it's very important that the fulfillment comes from you and comes from that you doing what you love, that you like having such a good day at work and come back and share the good news with your partner, and you guys grow together and being supportive with each other.
Um, what is the most important thing that we do for ourselves to make sure that we maintain in a positive mindset? Because look, no matter what's going on, we control our own well-being, but what's something that we all need to do to maintain to start our day and make sure that we're in a good mindset?
Mm, you mean what we should do or
Yes.
what's
Yeah.
important? Well, I think the number one thing that came to mind is integrity. Like we should absolutely be 100% honest with ourselves at all time. If you don't like something, say you don't like something, and don't say that you do, because then you are having an internal and external incongruency. Um, so that will cause all kinds of trouble through your health, relationship, or manifested through the people you attract. Like, it's a chain reaction. So step number one is to have the integrity intact. So the famous book, The Way of Integrity by Martha Beck, she said that our final home, well, it sounds like a final home as if like it's not. So it's like our true home is peace. And to get there is through the way of integrity. And I 100% agree. I think you are the one feeling your own feelings. And if you're not having integrity, then you will feel the internal struggle, stress, conflict, all the negative emotions. But as soon as you got 100% honest and clear out all the confusion and anything that gets in the way, you'll feel a sense of peace. And that sense of peace will attract peaceful situations.
How often do people, you mentioned that you were working 80 hours a week. How much people, how many people take and overload themselves at work to run away from home life? And I ask this because you know what? That's exactly what I was doing prior to my motorcycle accident. I
Wow.
was working 70 hours a week to stay away from home. And
Wow.
and and I was just thinking to myself, Sixu, that yeah, I should have met you about 10 years ago. You know, I because because that's when I was working for someone else and having all kinds of issues. But uh, do people stay at work and work themselves into, into problems because they're trying to run away from things?
Absolutely. I mean, I'm not trying to be a psychologist here, but it's very common people use work to distract themselves from feeling emotions. That's why people become workaholic because they don't know. I mean, they are gonna feel negative emotions or pain or have to deal with the uncomfortable emotion they don't want to deal with if they stop being busy. So they have to constantly stay busy so they don't think about the emotion. But the emotion never goes away; it just gets suppressed, and they just get more and more unhappy. And it's almost just like the sand in the water. The water is never gonna get clear until you take the sand out. And you can't pretend it's not there. It's always gonna be there. Yeah.
What was the thing that turned you from interior design into coaching? What was the moment?
That's a great question. Well, chronologically speaking, in terms of timeline, it's the pandemic. And I'm sure the pandemic shifted many people's life. But even before the pandemic, I was evaluating my life in terms of, do I want to just do this for another 5, 10 years? And I was working at a smaller interior design firm and seeing my boss owning the firm, but being stressed, and her herself have to work until 9, 10 p.m. every day. And I'm just like the best I could do is owning my own firm eventually. Do I want to? And I realized I don't. I don't want that kind of lifestyle. I want more freedom in terms of I don't want to work that much and make work becoming my life. So, and also I feel lucky that I got laid off. That forces me to rethink what I want to do next because after that many years of burnout, you really do not want to do another interview to just get into the same burnout. You know what I mean? Like I have such a resistance to put my resume together and go to more interviews for the similar type of job because what people tend to do is, it's the same resume that gets you this previous job, you're going to get another job just like that. And I just didn't want to do that. So I went through a soul searching journey and really asked myself what else I can be doing, what is really making me, what really could be the reason to get me off bed. And then I realized I want to help people. And if somebody needs my help, that will really get me off the bed in a second. And then look into how that looked like. I actually thought about becoming a therapist and counselor and social worker and all that. But then I realized coaching has all the other kind of factors that I'm looking for.
You had the ambition to start this, but how careful did you have to be that you went from putting everything into 80 hours a week, working your butt off? How careful did you have to be that you didn't just go on ahead and say, you know what? Nope, I can't do this. I got to go back to doing the 80-hour thing. I'm just going to slip back into what I know and to heck with everything else. How careful did you have to be? And how often do people fall into that trap that, I want to do this, but I need to get back to the grind?
Well, it's that emotional security, like it's security comfort zone versus taking a risk, taking leap of faith, facing the unknown, right? And for me, I just know the past was absolutely what I do not want. I do not know what the future holds, but I'm definitely not going back. And that was clear for me.
Yeah. Mm. I joke about this all the time. I tell people this all the time, that one of the first things that I thought of, and this is going back to where you said that, I thought about doing my own firm, but then I decided, no, that's not for me. I had my own transformation right there, because my first thought was, enjoy being part of creating events. So I'll get into being an event planner. But then I had that instantaneous thought in my head, oh no, 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 I don't like people enough to try to plan events for them. Getting into that high level stress area with people, that just wasn't going to work with me. I mean, having that much wound up stress between two people probably wouldn't have been a good idea. So how how much do you try to convince people to take a second look and make sure that this is what they want to do? Because we are a species that springs to action a lot of times without giving it much thought.
It's because we're in survival mode. I
Okay.
try to convince people that once you have the self-confidence, you know who you are. I mean, my whole journey that I take people through is the self-discovery the self-discovery process to help them understand themselves so they know who they are. And at that point, they have more self-confidence, because the reason people are not confident is not just because they don't have confidence, because they don't even have clarity. They are in the confusion mode, so they can be easily swayed in any direction as the wind blows. Somebody say, hey, this could be good for you. They're like, oh, maybe they're right. And they'll be like, oh, this makes so much money for this person. You should try it. It's like, oh, I should. Like, you just get swing into places and you don't trust any of them because they're not coming from you. So it's still so important that we make decisions that come from our knowing, our intuition, and backed by the evidence of us knowing ourselves. And I had that clarity. I know that I want to help people. I know that I want to make direct impact in others' life. I've been doing that kind of to family and friends all my life. And I realized that this is something I naturally are good at. Like it's something that comes naturally. You know what I mean? Yeah.
Mm, you got too many people who sit there and they listen to what other people say, and they fall off their dream train.
Oh yeah.
It's like, well, that's a ridiculous thing. Why would you do that? And uh there's a there's a book that I'm reading or listening to. I'm sorry, I don't read. I listen to books, but it's a book about starting something stupid, because there are so many things, so many or businesses out there that they were told this is stupid. Amazon, Jeff Bezos was told this is stupid. Who's going to shop from home?
Everyone now.
Apparently. So it we need to realize that, you know what, just because somebody else doesn't understand it, a lot of times that could be because they don't see the concept like you do. I mean, hell, the trying something that nobody else has ever done is not easy. If it was easy, somebody else would have done it, right?
Exactly. Yes. And this is what I keep telling people. You are the only you that have ever existed, and you're the only you that ever gonna be. There's no other exact you somewhere living some other life that you'd be like, ah, that's my reference. Let me just copy that. I'll be, having a great life. No, you live your own life and there's no reference. That's why it's like my people say, oh my God, I feel so behind. No, nobody's behind because you're not following anybody. Like you have your own path. You are the lead. Like you are always number one on your own path. Nobody behind, nobody ahead. It's just you. Maybe somebody is doing parallel paths, But in terms of your unique path that looks exactly like yours, this is one and only. So find that. It'll be fine.
That is that's such great advice. Tell me about the Great Discovery.
Oh, that I just encountered it this year because they launched March 2024. I feel very blessed and fortunate to be part of it. An artist named Dave Olds introduced it to me. And when he introduced to me, he said if I could create an art lesson and people from Africa will pay only $2 to learn it, I am in. Like my education is now actually accessible and affordable. So, which really touched me too. Just like, wow, there's something like that to allow knowledge to finally be accessible and affordable. And what the Great Discovery does is basically have all the above that I just mentioned. It has the AI translation technology, which will translate your knowledge into 100+ languages, so the language barrier disappears, and then it matches the price to the local economy. So there's no more, oh, I can't afford a first country education thing anymore. You are in a third world country, no problem. We're gonna match the price to what you can afford, and you can afford um, the education in US without being in a US school. Isn't that amazing? And also, it's a community, it's a marketplace, it's a affiliate marketplace. It encourages people to share and then earn while they share, rather than just giving the resource away and nothing comes back to you. Once you share, you get commission, you get passive income, and for me it's like I've been looking for a stream of passive income, and there's a lot of opportunity out there, even like a drop shipping to like uh MLM selling products and stuff, but that takes me away from my business. And
Mhm.
the Great Discovery doesn't take me away from my business. In fact, it enhances my business, it supports my business. I am selling my courses on the Great Discovery. I am allowing my client to access my knowledge through the Great Discovery, right? Like I'm not going away from my business. This is a platform, a tool that I can use to expand my business, to grow my business. So, I mean, I just feel so fortunate to be part of it.
See, that is so neat because I one of the things that I do to relax, and I don't do very many things to relax. I love work. I love doing what you and I are doing together. I love doing this. This is meaningful and relaxing to me. But one of the things that I absolutely love to do, and I do it throughout the day, all day long, is learn about history. And that really brings to the way that I ask you about your history. I really think that learning about people's history and learning about the past is such a great way to relive or to live our future. And so I think having something like that and sharing knowledge with other people, that's so important, because there's something in everyone's story. Everyone has that one piece of their story that can change someone's life for the positive. Because you are right that every single one of us, there's only one of us, there's only ever going to be one of us. But every single one of us comes up to a point in time where there's a problem that if we see it from somebody else's view, it could help us get around that problem. And I believe in conversation, that being one of the most important things about conversation and learning. So I'm excited to learn more with you about the Great Discovery. So, uh, Sixu, did you have anything else that you wanted to tell people before we cut this short?
Sure. I mean, to wrap up the Great Discovery, Dr. Harris, one of the team leader, he said something it really struck with me. He said, instead of doing entertainment like Netflix, just let your kind of mind cruise and kind of you are almost in like a half sleeping mode when you watch those. Do edutainment. Like there's so many good content on the Great Discovery that help you gain knowledge. I have a client come to me because they want to change their job. It's just for the past 5 years, they see no growth, just doing the same thing. There's no new knowledge being gained. There's no growth happening. But if you go to the Great Discovery, just search any subject matter, psychology, business, cooking, music, art, like anything that you want to learn, there's going to be information content for you to learn. So on your spare time, instead of just watching a show, you could just learn something, and it's entertaining because it's a video form, and it's interactive, and it's a fun experience. So
I think
that's what
it's a
I'll say about the Great Discovery. But in terms of my coaching, I just want to tell people that I am here to support people find the job that aligns with who they are. I keep telling people, if you do not like your job, guess what? You're not doing your job. That's someone else's job. You're taking a spot that someone could love. And you are like miserable here. Like, just get out of that spot, leave it open to someone else who is gonna love, and find something you're gonna love. And everybody's gonna be happy, right?
See, it's amazing listening to you now and remembering who I was, because I did every every day, Monday through Friday. I I repeated the words, "I hate my effing job,"
Oh my God.
every day for 8 years. But I was there, and I had put in 70 hours before noon on Friday. I mean,
Wow.
I was working from Monday morning until noon on Friday, and I would have 70 hours. And then I would immediately jump on my motorcycle, and I would be gone doing fundraising stuff, and just always trying to stay busy, because I was trying to forget problems instead of deal with problems. And
Right.
I realize this now, you know. Um, I mean, life for me has gotten a lot better. I'm with the right person now, and I don't drink hardly any. God, I had a beer the other night, Sixu, and I felt like it was kind of funny. It was like, wait a minute, that was like one small beer, and I was like, oh boy, this is not right.
Yes.
So, but it is, and a lot of that has to do with the clarity of knowing what I want, knowing where I want to be, and really working hard to get there and
Mhm.
be there. And my thing is, I want to work with people like yourself to help other people. And I think that when we do this, it just benefits the world. So
Thank you. And I really appreciate what you do too, that you pay it forward. I really appreciate that it creates a positive ripple effect, and I want to be part of it for sure.
um, we are very, very glad to have you. People can find you where?
They can find me on SCCoachinggroup.life. That's my website for career and relationship coaching. They can find me on LinkedIn just by my name, Sixu Chen. I think there's not a lot of me with that name on there, or on Facebook. I am very friendly with people's friend request. I sometimes share valuable information. If people want to be friends on Facebook or reach me on LinkedIn, I'm usually welcome that, and then we can start talking. And if it makes sense to get on a call, I'm always happy to get on a call with people. So if someone who are listening now are struggling with either career or relationship or unsatisfied, you don't have to be. Let's talk, and I want you to start feel more fulfillment starting tomorrow.
I love it. I appreciate you so much. I appreciate what you're doing, and I am really looking forward to working with you for a long time. You can also contact her at info at c at SCCoachinggroup.life. That's info at SCCoachinggroup.life.
Yes, that's the email that you can
Yeah.
use to send me. Mhm.
So, and then you can get a hold of all of her social media links, her email address, all of that stuff by going to communitypayitforward.us, and you can find her under family needs. So, Sixu, I want to thank you so very much for taking the time to talk to us today. I greatly appreciate this, and I invite you to please your post that where you're sharing information, please share them with our family. Let's let's make sure that people see you and your genius, and let's help as many as we can.
Awesome. Thank you so much. And the last thing I want to mention is that I'm also LGBTQ friendly. I have supported transgender and lesbian, gay, doesn't matter. It's just who you are. I went to Pride myself, and I want to encourage people to be unapologetically themselves.
You know what? I want to say this, and I'm not bringing the politics into this, but I do want to say this. The other night, I heard Joe Biden talk about the first time that he saw two men being affectionate with each other. And he looked at his dad and he said, and he kind of was taken aback. And he looked at his dad, and his dad said simply, they love each other. It's all we need.
Exactly. We're all souls, and we're just having different expression in our physical body. It's that connection that we feel with each other that draws we towards each other. It's that love energy. Absolutely.
Look, we're all a little alien to each other. We don't have to understand each other completely. And that's a good thing that we don't have to understand each other completely. But we need to remember that everyone's allowed to be themselves, because if they're not themselves, they're not being true. And
Exactly.
they're never going to be happy if they have to live up to your expectations.
And everyone deserves the basic human desire is to be respected.
Absolutely. All right. Well, Sixu, thank you so very much.
You're welcome. Happy to be here with you.
All right.
MAGA Republicans held a hearing today, or are holding.
Sixu Chen, fantastic. Such a motivated individual. She really does a lot. I was invited to one of her meetings the other day. She's starting an NRG networking program in the Seattle area. So she invited me to go and join them. And it's amazing when you go into a networking place and you can tell how much people respect each other. Look, let's be honest, a lot of us have been in networking things where you're there, you're talking to the same people you talked to last week, and there's times you just don't even know why you're doing it anymore. Sixu was very, very well respected. Everybody was so honored that she was in the group and had invited them, including me. It was a great time. So you can find Sixu on Community Pay It Forward by simply going to Community Pay It Forward / family needs. Family needs. And you can find out more information from her, including watching the interview that you just watched again. Was there something that you maybe missed? You can watch the interview right there and see if there's anything that you need. You will have all of her information, including her website that you can go and check out, which is SCCoachinggroup.life. Okay, it's .life. I like the way she did that, a little bit of an individual, but this will tell you more about her and her coaching program and what she does and everything. So just such an energetic and beautiful young lady, and I really did enjoy hanging out with her, and I want to thank her very much. I hope to get her back on sooner rather than later. Hey, our friends at Dignified Dementia, they were supposed to be joining us last week, and unfortunately Jennifer ended up catching COVID, and I hope she's doing better. I have failed to reach out to her, and that is my bad. I will do that. Coming up on the 17th, they have Jim's Journey fundraiser. This is a fundraiser that's got a lot of fun, a lot of activities, and so much more going. You can find out more about these activities and more about what's going on by simply visiting our page, Community Pay It Forward, or Community PIF on Facebook. If you go to Community PIF, you can find out more. It's at the beer garden, and I know that there's going to be cribbage and other activities in honor of Jennifer's father. So please join them. Support Dignified Dementia. You can also make sure that you support Dignified Dementia by simply scanning the QR code that is attached to her page. Or, where'd you go? Geez, I can't tell if that's the right one. No, it's not. This is the right one. Okay, there we go. Or you can scan this QR code, and anything that you do, any purchases that you make, a portion will go to supporting families who have someone battling dementia. We ended up having a conversation with somebody who's starting to go through the difficulty of dementia within their family the other day, and it was just heartbreaking that you start to see somebody who they not only lose the thought on who you are, but they lose the thought and the remembrance of who they are. And they don't remember things about their life. And it's just It's just an awful situation, and it's something that I definitely don't wish upon anybody, because it's just a sad, very sad situation. But Jennifer is trying to take and build a program to help people keep their minds intact just a little longer. So please make sure you visit Dignified Dimension. If you're in Denver on the 17th, please visit them and support their Jim's Journey fundraiser. I want to thank everybody for coming on and joining us. I want to thank Les for joining us. It was a really, really good time. Remember, if you have any questions about anything that you heard this evening, very simple. All you have to do is reach out to the man with the plan, Mr. Les Simpson. Go to 303-579-6881, 303-579-6881, or email him at les, L-E-S, at threewaystobanking.com, LES at threewaystobanking.com. You can always reach out to me at communitypayitforward.us. Once again, that's just communitypayitforward.us. You can email me at Zach at payitforward.us, communitypayitforward.us, Zach at communitypayitforward.us. Or you can send us a text message at 970-909-0751, 970-909-0751. A text message is the best way to get a hold of me, okay? So send me a text and I will get back to you. But I think we're going to call it a show for the evening. Again, I want to thank you so very much. Have a great week. Have a great weekend. If there's anything I can do to help you out, please make sure that you reach out. Because remember, you should really love somebody out there, because somebody out here loves you. If you're not helping someone, you're hurting everyone. Please remember, no one needs to go it alone. When we all come together, let's work together. Let's make this a better place. Thank you, and we'll see you next week. Looking to make a difference with your shopping? Visit communitypayitforward.us. Select the mission or cause you want to support and scan the QR code. You have two options. Click the first link and browse our giving partners, or use the second link to tell us what you need, and we'll find the right partners for you. Shop with these partners and keep your receipt or invoice. Next, click a picture or simply upload a picture of your receipt to the portal in every form, adding your name and email address. Your purchase now turns into a donation to the mission you've chosen. Community Pay It Forward shares your business story with those in need of your services to rally support for those who need us all.
stepping out of her fear. Bring me home, out alone, and show me the way. You wanna be a part of Sunset Boulevard.